Welcome to this special Beth Tzedek session on COVID. My name is Dr. Eddy Lang, and I'm a very proud member of the board at Beth Tzedek, and very pleased that the synagogue has pulled together a Zoom account and that we are able to have what I hope will be a very important session. We have 26 individuals who have joined so far, and I will just give you a bit of an overview of what we're going to do today and make it hopefully as interactive as possible. Just a few technical points. We may run into some bandwidth or internet issues, and while I don't think that's the case right now, I may be asking you to turn off your cameras so that we can hear you, so that we can allow the communication to occur more clearly. I also would encourage you to use the chat function at the bottom if you have any questions that you'd like to ask. And I already see that Carrie Brody has asked one, and I will be addressing that absolutely. So great. I hear very little sound background in the background, so that's great. But again, I would encourage everyone who's joining to go on to mute so that the noise level is as low as possible. So my name is Eddy Lang, Dr. Eddy Lang, and I am the head of emergency care, the physician in charge of the 4 adult emergency departments and the 220 emergency physicians that work here in Calgary. And it's a real pleasure to have this opportunity with what was initially supposed to be a face-to-face meeting with Chazak, but has now gone to a congregation-wide town hall, if you will, on the COVID problem. I'm going to begin just by making some general remarks about what's happening in the emergency departments and in the hospitals, speak a little bit more broadly about Alberta and the response to COVID in the healthcare system, and then I'm going to speak more individually to what I think the Beth Tzedek community really needs to know about this pandemic and how to prepare and how to be as safe and careful as possible during this difficult period that we're living through. So, of course, if you're watching the news or any kind of media outlet, you will know that we are in a very difficult time, an unprecedented time on this planet, with a health catastrophe, if you will, that we have not seen since the Spanish flu in 1918. The statistics are available at a number of websites, but we are currently looking at over 500,000 confirmed cases of the COVID virus infection, as well as over 23,000 deaths, if I recall correctly. And this is turning out to be a very difficult infection to both to diagnose and to treat. It's affecting primarily frail, older individuals. Usually the disease is more severe in those over age 60, as well as those with existing medical problems. And what happens is the virus triggers a severe pneumonia in the lungs, causing the lungs to fill up with fluid, and there is, as of yet, no effective treatment. Some patients will improve on their own with oxygen treatment. Some in whom the degree of respiratory failure, as we call it, require ventilation. Some of those who are young there have been some cases of patients being able to come off of ventilators, but unfortunately, for the most part, once you go on a ventilator, the prognosis is very guarded. So, so I'll start with what's happening in the hospital. We are quite fortunate in Calgary emergency departments that we have had ample time to prepare for this situation. And we've had tremendous support from Calgary Zone Health Services, Alberta Health Services, in that we have been able to do a great deal of testing away from the hospital and keep the infection away from the patients who are already in the hospital who are at risk, and from healthcare providers, because it is a scary time to be a healthcare provider in Alberta or in anywhere in the world, because 10% of the victims of COVID are healthcare providers, and the severity of the infection is more significant in healthcare providers, presumably because of the amount of virus that can come on us when we are treating patients. So we have been able to, the emergency departments are actually very quiet at the moment. I don't know if you've checked the wait time app that Alberta Health Services provides, but we've seen a 30 to 40% reduction in emergency department traffic, largely because of very good education. And I think, honestly, people are afraid to come to hospital because they are worried about getting the COVID virus. That's a very tricky message. We want to be careful to make sure that people are not staying away when they do need to come to the hospital. So we've done ample preparation. We have already admitted some 20 to 25 patients with COVID infections into Calgary hospitals. The intensive care units have a few patients as well. And our entire healthcare system is geared up. And in fact, all of our hospitals have now become COVID hospitals. All of the elective surgeries and almost all of the outpatient clinics have been canceled to focus on the COVID problem. One thing that you're certainly aware of is the messaging that's been coming from Alberta Health Services and from the Public Health Agency of Canada regarding the importance of distancing. Some people have been calling it social distancing or physical distancing, but if you apply these measures very carefully in your everyday lives, your chances of contracting the infection drop dramatically. And we've seen examples in Singapore and in Taiwan where the infection has in fact been significantly controlled as a result of these very aggressive measures, meaning that people have been ordered to largely stay at home and be very cautious about where they go and going into a crowded area, and that would even include a shopping mall or a grocery store. The other cause for concern, of course, is our elderly population, and especially ones that live in assisted living or in nursing homes, because for a variety of reasons, this infection tends to circulate quite quickly and quite dangerously in those settings. So access to those facilities have been quite limited, and it's created a problem for social isolation of the residents, but it's probably a very important thing in terms of their safety. So I'm just going to make one more kind of general comment. I see a lot of really good questions in the chat window, and I will be able to address those quite quickly. As we've seen, this is a very dangerous infection. I'm just going to mute you, Alan. Thank you. This is a very dangerous infection, and I know that in Alberta we do very well in talking to individuals, if they're older or even regardless of their age, to know what their advanced wishes would be in the event that they were to get they were to contract COVID or get very sick from COVID. These are very delicate and very difficult conversations, and I wish and I hope that they will not be relevant conversations for any one of you, but they are still very important conversations to have with your loved ones and with your family physicians, even though you may not be seeing them directly. So This is an important time to think about and to discuss with your family and loved ones the whole idea of advanced care planning and advanced care directives. I'm going to shoot into the chat box, and I've sent it to the 34 of you who are on the call right now, the web page to the Alberta Health Services Advanced Care Planning resource page, where you can read more about all this. And really, this is about your autonomy and your wishes, and to know that your preferences be identified now when you can make it clear as to what your desires would be if you were to become somewhat sick from COVID or very sick from COVID-19, and that these wishes would be honored if you were to come to the hospital or become ill in wherever you might be. So those are my general comments about COVID. There's an incredible amount to say, and I'll be happy to share other resources, but I will begin by starting in with the questions. And Carrie had a very good question. She was the first off the bat. What do you do if you have a medical emergency and it's not COVID related? Well, this is a really good question, and what I would say is that if you were suffering from a severe medical emergency, which would involve, let's say, severe shortness of breath or chest pain, or if you've fallen and you can't get up and can't walk, I mean, this is still, we still have a completely and highly functional healthcare system, and you or your family member should call 911, and an ambulance will be dispatched to you to evaluate and address this medical emergency if you need to be transported to hospital by ambulance. And that's absolutely at play now, and no different than it was before the COVID crisis. If the nature of the medical emergency is not so acute, I would urge you to either call 811 or HealthLink, and they are taking now thousands of calls a day, mostly related to COVID actually, but a professionally trained nurse will be able to help you at that time to decide what is best for you, whether it be to wait until you see a family doctor, your family doctor, or they can even arrange for you to have a next day clinic appointment, depending on what the nature of the problem is. So although the HealthLink call center has been quite challenged with the COVID pandemic, patience is important. Maybe calling at off times would be valuable, but you will get through to someone and you can ask them for your medical advice. Say, for example, it's not an immediate emergency. Let's say you've been reading high blood pressure values, or your sugar has been a bit on the low side, or whatever it is. If it can wait and doesn't require an immediate ambulance, if you can't get in touch with your family doctor's office, which would be ideal because they now, in this COVID crisis, have the ability to evaluate you via Skype or FaceTime, and they will be paid for the care they provide, even though you never have to go to your office. These are brand new innovations that have come across Canada as a result of COVID, and really, personally, it's about time, because we've been able to do our banking online. We can do so much from the comfort of our home and our computers and our iPads and our iPhones. It only makes perfect sense that we be able to get medical care through the same tools, and we do not need to go to your family doctor to renew medications. So Carrie, I hope that answers your question about what to do if you get a medical emergency. Thank you for the response. I'll move on to the question about the pneumonia shot. So Irvin, you're talking about the Pneumovax vaccine, which is a very good vaccine to get because it prevents a very common kind of pneumonia called pneumococcal pneumonia. but unfortunately, it will not prevent COVID pneumonia. It may reduce the chances of having a COVID pneumonia that's very severe by a small percentage, but the COVID pneumonia occurs through a syndrome that we call acute respiratory distress syndrome, or ARDS. And that's where the lungs become very leaky. The blood vessels leak fluid and the lungs fill up with fluid and oxygen doesn't get into the blood. And this has nothing to do with the pneumococcus bacteria that the pneumovax vaccination is preventing. So I would certainly encourage you, if you haven't already had your pneumovax, to contact your family doctor, to contact your family physician, to see if you are eligible or you should get the pneumonia vaccine. And if that's the case, by all means, go get it. But it is not in any way a shield or a protection against COVID pneumonia. Your best protection is to stay home and to, especially if you're older, to see if you can get help from neighbors or family to bring you food, leave it at your doorstep. This is an incredibly transmissible infection. We've had cases of people catching the pneumonia simply being at the same dental conference or curling event or same elevator. The virus lives on surfaces for hours or days. So if you are touching a tabletop or a door handle that has COVID on it and then touch your face, which we do unfortunately all too frequently, you can get COVID pneumonia, a COVID infection. And again, this is really, for the most part, a very benign infection. In children, it's almost uniformly a very, very mild case of the sniffles. In adults, it's still, up until age 60, it's usually a very benign thing. And even older than age 60, your chances of getting a serious complication are only about 10 or 20%. There is also the distinct possibility that you are infected with COVID-19 virus and you don't even know it. There are many cases, and there's believed to be a significant percentage of the population that are what we call asymptomatic carriers of COVID-19, who can spread the infection but are unaware that they have it. And I think Sanjay Gupta probably said it the best on CNN a few nights ago. For the time being, I think we all have to pretend or believe that we all have COVID and act accordingly, whether it be frequent hand washing, using wet naps or wet wipes. Here I have some right at my desk to make sure that things remain as sterile as possible, and to limit the circulation and approaching other individuals. One thing I would like to also mention is that one of the very first symptoms that we're now seeing that can be associated with a COVID infection is the loss of taste and smell. So I wouldn't at all panic if this is something that you might experience or a relative somewhere is experiencing, but it is probably one of the early signs of a COVID pneumonia or COVID infection. Alan, that's a really good question about vitamin C to prevent COVID, and the answer is no. It's the vitamin C is not shown to be protective against any kind of viral infection, and there's really no reason to think why it would prevent a COVID infection. In fact, so far, all of the medication approaches have been quite disappointing, whether it be the malaria drug called chlorquinolone or some of the other more expensive antiviral medications. They have all been not helpful. So I'm awaiting more questions from the chat window. Maybe I need to go to everyone here to see. Yeah, so please send along your questions. Thank you, Arlene. And before I get to that, I just want to mention something that quite important that's happened in the last few days. So Alberta leads the world in testing. We test 3 times more than any other province, including Ontario. And this has been critically important in fighting the COVID battle here, because without testing, we don't know who has and who doesn't have the infection. We've also been very innovative in recruiting doctors who are not working right now because they've closed their offices, or their clinics are closed, or they've had to self-isolate because of travel. And we're using medical students and these doctors to do something that's a very important public health measure, which is called contact tracing. So if you somehow, whether you went to the assessment center on Richmond Road or called 811 and arranged to have an appointment for a test, if you had a test, nasopharyngeal swab done to test for COVID and it's positive, you're going to receive a phone call the very next day, and you're going to be asked to trace your steps for the last few days to see who you came in contact with and who you might have been in touch with, and they will be contacted and they will be told to self-isolate, waiting for any symptoms to appear. And that's an incredibly important and effective measure to control a pandemic or any kind of outbreak. But in order to have a more focused strategy, Alberta Health Services announced earlier this week that they will only be testing high-risk individuals. And by that we mean elderly who live in nursing homes or assisted living facilities, patients who we are admitting to the hospital, or people who provide care for the elderly. They will be tested if they have symptoms. And so what this means is that if you develop the sniffles and you do want to go and get tested, you will call 811, but you will likely be told that if you're not in a high-risk group, you are no longer eligible for testing, and that you will have to treat yourself as though it might be COVID. Be very, very careful. Watch for your symptoms. Watch for shortness of breath, which is the key alarm signal that your COVID could be more serious, and treat it that way. So let me look now at the windows here. Arlene wants to know if it would be okay to have my mom come into our home for a visit or a meal if we both have self-quarantine ourselves for 14 days with no ill effects. Well, that's generally a reasonable thing to do, but as you know, I mentioned that asymptomatic transmission is possible. So even though you've been quarantined and are not aware of any symptoms and feel fine, there's still a small risk that something could happen. So, I think you need to exercise your caution and exercise caution. But if the nature of your home is that you can keep your distance, you have plenty of hand sanitizer, you're going to be serving the food in a very careful way that doesn't risk contamination, and there's only one person serving the meal. If you're both healthy and there's been no symptoms for 14 days, I think it would be a reasonable thing to do. And it's not perfect self-isolation or perfect social distancing, but I think we need to be somewhat realistic as well. So, I mean, I don't think it's been 14 days since we've launched into this full-blown pandemic, but if at that point you're both feeling well and you haven't been out into large crowds and have been very careful with physical distancing, I think that could be reasonable. So Karen wants to know, and I hope that answered your question, Arlene. Just let me know in the window if that's okay. Should we handle groceries when you bring them into your house? Well, so Karen, that's a really good question. And well, I think it's absolutely fine. I don't know how else I don't know how else the oranges are going to get into the fridge. So yes, of course you should handle the groceries, but if you, I'd like to note that Some of the grocery chains have gone to the trouble of ensuring seniors only time for shopping earlier in the day. So you might want to take advantage of that if you're in the senior category. And then there's lots of hand sanitizer available in the grocery store, so you should be definitely using that. And then once you're home and you've put everything away, don't touch your face, but go ahead with a lot of warm soap and water, wash your hands again, and everything should be just fine. So Alan, you've just returned from the US, you have no symptoms. Does self-isolate mean we cannot go for a walk provided we distance and don't touch anything? Great question, and thank you so much for self-isolating, because you're very much contributing to the solution. No, we have a beautiful, expansive city, great trails on Glenmore. If you are self-isolating and you're feeling well and you have no symptoms as you've written, you can go for a walk on your street, on your bike paths. Just keep that 2-meter distance from the people that you're passing. It's not rudeness, it's just good measure, and you are just fine. So enjoy the good weather and the fresh air. It's very important to all of our well-being. So even if you came from New York City, which is a terrible place right now for my colleagues in emergency medicine, you are free to take a nice distanced walk in the neighborhood or in a park. So Max, thanks for this question. As we practice safe measures, the question, ability to interact with kids, grandkids by bypassing physical distance after 2 to 3 weeks of self-isolation. So Max, I'm going to tell you some of the stories we've been hearing from Italy, which has been hardest hit. And when the pandemic broke, what happened was there was a lot of strain on healthcare providers. A lot of them were young parents. And what they did is they took their children to Sadie and Saba and Safta and left them with their Italian grandparents. And it's widely believed that the reason COVID has caused such a terrible effect on the senior population in the Lombardy and northern Italian regions is because of that approach. So kids, they're beautiful, we love them, but they are clearly able to carry COVID in a way that is almost imperceptible. And I mean, which kid, even now that they're off school, which kid does not have a slightly runny nose? So I would exercise extreme caution bringing grandchildren together with grandparents within physical proximity. And again, you can do the physical distancing, but if Mikey, who's 5 years old, is climbing on this and handling this and touching this, that is potentially a way for the virus to propagate. So I think for the time being, until you hear that Alberta and Calgary have achieved early containment, if you see the number of cases per day leveling off at whatever the number would be, whether it be 100 or 150, and then start to go back down, and we're starting to get the upper hand, that will change. But for now, I think one of the riskiest interactions for COVID is between small children and grandparents. So I hope, Max, that addresses your question. Thanks, Max. So back to Carrie. Oh, no. So how do you say? Okay, yeah. So Carrie wants to know how this is going to play out. Well, you know, I think I'm a half glass full kind of a person and naturally optimistic. I think we have a number of things going for us. Number one, you know, I live in Garrison, Altadore, and my favorite pub, the Garrison Pub, has closed its door to visitors and is only offering takeout. So and they're a very busy pub, as you may know, and they have my picture on the wall even because I'm one of their best clients. But they have closed their door, and this means that I think everybody's playing a part in serious physical distancing and isolation, and they're only open for takeout right now. So because we're all on board, and because we have we're attacking this early on, you know, we only, you know, still at the present time, there's only 20 or 30 serious cases in Alberta, and only a few in the intensive care unit. I'm going to try to share the website where you can get all of the up-to-date information on what's happening in Alberta. It's a wonderful website. We're very lucky because we're the only province in Canada that has this kind of detailed data. And so because we're getting on top of this early, and because we are all coming together and practicing good hygiene, I think we can have, hopefully we can have this under control in a few weeks. I wish I could be more specific, and I just put the link to the statistics page, which is very easy to navigate and very easy to understand. I think we can. I think, you know, I don't think we're doing any big family seders, unfortunately, but hopefully by mid-April, late April, when things calm down, we will see a slow return to normal, which is currently what's happening in Wuhan. All of the businesses are opened again. People are still being cautious, and they're walking around with masks sometimes. But if they can get it under control after a massacre of human life from COVID, we can certainly do it with only the beginning of the problem. So Carrie also wants to know, should home care nurses not be wearing masks and gloves routinely as to not transfer undiagnosed COVID between patients? Well, I wonder, Carrie, if you were listening in on the emergency operations call this morning. That's actively being discussed right now. The concern, of course, is that if we exhaust our supply of protective equipment for healthcare providers and we burn through it now, Switzerland is using 1 million of the N95, the very special masks that are required for risky procedures. If they're using 1 million masks a day, certainly that will not be sustainable. So it's a delicate balance between careful hygiene and not burning through equipment, but you may well see in a short order that that we are going to be seeing all healthcare providers who provide frontline care to be wearing regular masks that will prevent them from acquiring the infection and them from transmitting the infection. So Ali wants to know, hey Ali, do all the boxes from groceries need to be wiped with soap sanitizer before putting them away, including, oh well, so teenage grandkids, I guess that goes back to the previous question. So I mean, I think if your teenage grandkids are completely free of sniffles, you can call them young adults, and I think that's probably okay. It's the elementary school age kids and maybe up to 12 years old where we know that the virus is very mild and very contagious. So, you know, I think we are still back to your main question about groceries, and I think this also includes takeout food. I don't think you need to wipe anything down before putting things out in the garbage or before or before taking stuff out of boxes. You just need to be always thinking that, okay, I've touched a surface that came from outside. It could be inoculated or colonized with COVID virus. I should now, after I'm done with the box, I should not touch my face, but I should go into the bathroom or go to the kitchen sink and do a good, generous 20-second hand washing with making sure that you get the hands all clean, especially in the web spaces just over in here. So I think this answer still applies to the takeout option, I mean, you know, it's still probably, you know, from a nutritional point of view, we can't abandon all of our health concerns completely. From a nutritional point of view, it's still probably better to eat home-cooked food, which is lower in fat and lower in salt. But I think if you are going to do takeout, you can. Most of these takeout places are offering door drop-off, which is, I think, perfectly fine. And then, just as I mentioned, once you've unpacked and thrown away the deliverable, you're on your way to a hand cleaning session. So, I mean, nothing is 100% safe. It's really about minimizing risk, and this is to Carrie's question about why takeout is safe. I mean, if you do the drop-off option, carefully clean your hands, the virus will not jump off of the styrofoam and into your mouth. And the food has been heated. Heat destroys the virus if it, God forbid, would happen to be there. So this is not generally considered a oral or an orally transmitted infection. Of course, that's a different story when you're coming into the emergency department with vomiting, because we've had many healthcare providers infected because of the vomiting that occurs with COVID. It's not just a respiratory illness. It's also a gastroenteritis type of picture as well. And so, you know, I think if you are worried about takeout, by all means, all your meals should be home cooked. If that's not possible and you need to order out once in a while, as long as you follow the precautions I mentioned, I think that's perfectly fine. So I hope that answers your question. I'm going to go now to the question on mom's caregiver be wearing masks and gloves throughout the day when she is with my elderly mom. Well, so you're talking about someone that you've hired to be her caregiver. Well, I mean, this is a one-on-one interaction, right? I presume he or she is not seeing multiple elderly people and isn't tracking the infection from one place to the other. So, I mean, if you have hired an attendant for your mom who's elderly, as long as she is knowledgeable with good hygiene practice, I do not think it's necessary to wear a mask. Now, if your mom happens to be in a seniors residence where there are multiple elderly people around, well, then maybe that changes the equation a bit. But if it's in her own independent home and it's just one-on-one care, I don't think she needs to wear a mask or gloves. So Alan wants to know, and I hope that answers Carrie, if that's okay. Alan wants to know, my wife thinks she may have ADHD. She may have had it in November. Yeah, so good question, Alan. You know, it's such a, I mean, we can just see this, right? Prince Charles got it. Tom Hanks got it. People in prison are catching it. It's incredibly infectious and widespread, and it would appear from the numbers that it's been circulating out of control in the United States for weeks, if not months. And we know that, you know, we all have many of us have relatives in the US. There are dozens and dozens of flights that had been coming into Calgary from the US before the border was closed. So clearly it's been widespread, but honestly, Alan, not November. No, it really only was identified in Wuhan in late December. So if you told me she had had something in mid-February, maybe, but either way, no point at all, and no one would test her for a cold or a flu or an influenza-like illness that she had a couple of weeks ago. So Stuart, thanks for this question. Mandatory self-isolation is now in place for travelers returning to Canada, correct? Does self-isolation mean completely alone, assuming they are not of minor age and can otherwise care for themselves? So that's a really good question, and I'll see if I can put a resource into the window. There is a whole art and science to self-isolation. And it does not mean putting yourself into an apartment all by yourself, but it means following a few simple rules that I'm going to, so I'm going to put a chat, I'm going to put this link into the chat window for everybody to see. But this is from the Public Health Agency of Canada, and it provides very detailed instructions on how to self-isolate if you're a returning international traveler. And it's a bit cumbersome, it's a bit onerous, but it's not impossible to follow. So I'll share with you, our lovely daughter Naomi was doing a semester of business school at Perth in Australia, and came back just in time for Shabbat dinner last week. And we were following the instructions, and she was sitting on her own at a coffee table 4 meters from the dinner table, having her own Shabbat dinner. We could speak to her, we could see her, we could laugh with her, but she did not join us at the dinner table. She also wore dishwashing gloves. I don't know where that came from, but I don't think it's really necessary for those who are self-isolating to wear rubber gloves while they're in the house. So Stuart, I hope that answers your question. I can't say I could speak to every detail on the site, but that is a very reputable source for how to self-isolate at home. Good. Well, thank you so much for those fantastic questions. I seem to have gotten through all of them, but you may have others. One thing I would insist on is really if you have a doctor's appointment or a medical appointment, you may want to find out if it's now possible to do it through a video link, a phone call, a FaceTime discussion. You know, I can see right now that that Bob looks to be in perfect health. He's not breathing quickly. Everyone else looks very comfortable. The face-to-face encounter is really not necessary in medicine for the vast majority of interactions, because it's really about information sharing and communication, and really about finding out how you're doing. And you know, you may have heard this, but there's a bunch of ear, nose, and throat surgeons across North America and Europe and in the UK who have all fallen ill because they saw multiple patients a day. They caught the infection by doing ear, nose, and throat examinations, and then they transmitted the infection to other patients. So we really have to completely rethink how we're going to do healthcare, and things are going to change. And this is really a good example of necessity has really become the mother of invention and creativity. And you know, we were doing things the same way we did them in medicine for 30 years, but now with the technology that we have available to us, it's clear that we are going to be able to use other approaches to do what we've always done. So we do have about 15 minutes left in what was scheduled for this session. Teresa, I'm going to unmute you. Do you want, oh, I can't, but do you want to see if the members of the congregation would want another presentation in the future, or get some feedback on how this was, or?
Yeah, and I think we're going to be putting this presentation on the website as well, so.
For sure.
Yeah.
For sure. And you guys, you know where to find me. If you have questions, then I'm happy to answer them. So Andrea has a great question about mental health, and it's such an important point, and apologies for not raising it, but this is a very difficult situation. People who suffer from some anxiety or depression or loneliness, which is increasingly being appreciated as almost a very serious disease because it is associated with bad health outcomes. Of course, the pandemic is going to make matters worse. So I call upon you as a community, as Beth Tzedek members. This is the time more than ever we need to come together. And there's a number of technological solutions that can help this. You may be familiar with something called Meal Train, which is a free website where someone who's in need of meal delivery can sign up and people can drop off some treats. There's this. We are having. I'm sure Beth Tzedek will lend you their Zoom account, perhaps, if you want to have a special meeting or a get-together. Skype is brilliant. If you have a good Wi-Fi connection, you can download a free copy of Skype, and you can bring together up to 20 of your best friends for a joke-telling competition or a sing-along or you name it, and you can record it. You can record it, and it'll be available as a video link for 30 days. And I think it would be amazing for Beth Tzedek to launch a competition for the best online version of Manishtana that you'll get a free box of Passover matzahs for, perhaps. So there's a lot of opportunity to help people through this difficult time who are facing mental health challenges. And honestly, everyone is, some more than others. So I think it's so important that we're there for one another at this time. So Karen wants to know, if people are jogging and breathing hard when they pass you on the pass, can they transmit the virus to you? It's a great question. And, you know, I mean, if there was a case, it may be hard to identify, but I think we would have heard about it. You know, what I would say, I think if someone were coughing and they were running at the same time, because coughing, of course, projects the droplets that have the virus in it. So if someone is coughing while they're jogging and they're within 2 meters, I guess there's a risk. But if they're just huffing and puffing and you're keeping that 2 meter distance, I can't think that it's a real risk. But I was out on the Glenmore Trail yesterday around the reservoir, and people were being very, very cautious. People were sideswiping you, walking onto the snow, walking onto the mud, to keep that distance. So I think it's still a good idea to get on your bikes, get on your jogging, you know, pull out that bicycle that you put away years ago because you were going to the gym. And it's important to stay physically healthy and mentally healthy during these times. And those two are related, because it's when you're in good physical health that you're going to have good mental health. Yeah, so Stuart wants to know, I assume while being alone is not mandatory, it is preventable when young adults yeah. So, I mean, it's all a matter of gradation and extreme, but for sure, if someone has just come back from New York, where the virus is out of control, and they live in homes with parents over the age of 60, and there is an alternative. Let's say you can move in with a buddy, or take an apartment that's not being used, or arrange for some alternative living arrangements, then that probably would be preferable, although I don't think we would consider it a mandatory thing. So that's a great question, Stuart. Thank you. Great. Well, looks like I may have exhausted the questions. I'm so glad the Zoom thing worked out. We're at 33 participants, and
we were at 36 at one point.
We were at 36 at one point, and thank you. Teresa? So we've really gotten through a number of questions. I hope you all take advantage of the resources that I shared, and happy to be of assistance if anyone has any further questions. I'll just add one more thing. A lot of people have been, these crises situations bring out the best in people, and what we're seeing is a lot of generosity from the community towards the healthcare system and offers to help. There is an email address. If you have an idea or something that you'd like to be able to help with or provide or volunteer for, there is a special email address that I'm going to try to bring forward here. Give me a moment.
Loaded into my car.
Yeah, here it is.
I'm just going to hang this all up here because just a minute here.
So here, the email is AHS COVID offer@ahs.ca. There it is in the window. If you have some extra masks or gloves lying around and you don't think you're going to use them, you feel free to reach out and see if you can be of an assistance if that's something you'd like to do. It's been my pleasure to be with everybody. My hair is on fire these days with a million things going on, but it's a real pleasure and an honor to be of service to the congregation.
Thank you so much for doing this for us.
My pleasure. And the answer to Edward is yes. Cancer and being recently on chemotherapy is considered a comorbidity and will increase your risk of not necessarily catching it, but having complications from the virus. So thank you, everybody. Have a great afternoon. I hope to see you out on the Glenmore Trail.